Welcome, and please proceed.
Good evening, Chairman and committee members. It's nice to see some of you again, and it's nice to see some new faces as well. You may remember me from testifying 2 years ago. My name is Marcy Fiban, and I'm a naturopathic doctor, and I'm the current president of the Rhode Island Association of Naturopathic Physicians. I grew up in Rhode Island, and I truly love this state. I graduated from Brown University with a degree in biology, and I later graduated from one of our... Am I standing too close? Okay, sorry. And later graduated from one of the country's 5 accredited naturopathic medical schools, the National College of Natural Medicine in Portland, Oregon, now known as the National University of Natural Medicine. I am passionate about naturopathic medicine and about helping people. The reason I continue to testify before you is because my colleagues and I continue to witness the need for naturopathic doctors to be licensed in Rhode Island. I want to briefly review 3 of these reasons with you. With the passage of this bill, safety will be addressed. You will likely hear from Steve DeToy today about the Unlicensed Practitioner Act. However, that does not cover the safety issues that we are concerned with. With this bill, Rhode Islanders will definitively know that a person calling him or herself a naturopathic doctor is someone who graduated from an accredited 4-year naturopathic medical school program, someone who passed their basic science and clinical board exams, and currently there is no law in Rhode Island that distinguishes who can call themselves a naturopathic doctor. Anyone can. That is not the case in 22 states and jurisdictions in this country, and most recently in Massachusetts, where the bill was signed into law this past January. Massachusetts is known in the country for its elite academic institutions and hospitals, and the licensure bill passed there. It passed because it was the right thing to do, to establish standards of care for our profession. In addition to safety, licensure will help increase Rhode Island residents' access to naturopathic doctors. There will be more of us living here, practicing here, moving here, as evidenced by licensed states, such as in Vermont. Since they've licensed naturopathic doctors, they started with 7 and they now have 50. Additionally, licensure will enable Rhode Island naturopathic doctors to work at community clinics and work with underserved communities, something many of us are very passionate about doing, but are unable to do so without being licensed. Lastly, I want to talk about healthcare savings. By addressing chronic disease via natural medicines, nutrition, botanical herbs, and lifestyle counseling, naturopathic doctors help reduce both individual and state healthcare costs. There is a reduction in the need and also the dose of medications, as well as a reduction in the need for certain surgeries. Employers also experience reduced healthcare costs in states where naturopathic doctors are licensed. Rhode Islanders want to see naturopathic doctors, and we want to work with them to the best of our ability and training. This bill will allow us to do so. Thank you very much for your time.
Well, thank you, Marcy. Are there any questions for this witness, Representative Donovan?
So, in Rhode Island, do we have integrated medicine physicians that do both naturopathy and conventional medicine?
In Rhode Island, there are some medical doctors that practice integrative medicine. They're actually one of our doctors that's going to be speaking. Well, he maybe have been caught up in his practice, but it was going to speak about this. So he's a medical doctor that has become more and more interested in herbs and nutrition, and so there are a couple. There are, I think, 3 or 4 in the state, and typically they're maxed out and have waiting lists, and it's very hard to get into them. But a big appeal is that patients have access to them, and those doctors can order labs and practice in the
Correct.
scope.
Yeah.
But they do exist, and we also have one naturopathic doctor who also is a medical doctor. He happens to be on vacation this week, but yes, so he does both.
So there aren't that many in Rhode Island.
No, integrative medicine doctors, no. Like medical doctors who do integrative medicine, there are not many, no.
No. And is that a different licensing procedure for integrated medicine, or they just call themselves integrated?
There isn't. There's just starting to be more programs in MD medical school programs to do integrative medicine, but right now it's more a specialty that some medical doctors are finding because people want this medicine.
Yes.
Thank you for your question.
Can I?
Yes. Representative Canario.
Welcome, and I remember your testimony from last time, and you did a fabulous job. Could you just refresh my memory in terms of your qualifications, I shouldn't say qualifications, but education versus an MD?
Sure. And I also would be happy to, at a later date, I can give you a chart comparison.
Awesome.
But so we all get an undergraduate degree where we're required to have the prerequisites to get into medical school, the same prerequisites that an MD would be required to prior to medical school. And then our medical school program is a 4-year program. The first 2 years cover the basic sciences that MD medical students would have. And then our second 2 years are clinical education, where we work in clinics and are supervised by other doctors. And then some naturopathic doctors also have residencies. Because we do general care, it's not a specialty where we would have to do surgeries or the fields aren't specialized. So typically we do general care, but there are some specialized residencies, like at Cancer Treatment Centers of America, a lot of.
But so you don't have a doctorate, is that what it is?
No, we have it's a doctorate degree in naturopathic medicine.
Oh, got it. Okay.
It is. So 8 years after high school, 8 years.
Got it. And thank you for what you do.
Thank you.
Representative Lancia.
Earlier, in one of the other bills that was testifying, Representative Canario asked about, what states you had whatever. Am I correct that the other 5 New England states do recognize naturopathic, and Rhode Island's the only one of the New England states that does not?
You are correct, Representative Lancia. Yes, that's exactly the case. In all of New England, Maine, New Hampshire, Vermont, Connecticut, and now Massachusetts are all licensed for naturopathic doctors. So we have patients traveling across borders to Connecticut and now it will be to Massachusetts to see licensed naturopathic doctors.
And I guess also Pennsylvania just recently passed it in November, bringing the number to 22 states now that recognize naturopathic medicine.
Exactly.
So the trend is going
Yes.
in a particular
and
way.
We have, I believe, at least 7 states that have active legislation right now. So this is the way of the future because people want this.
People want more choice.
Yeah, more choice and access because it's integration. We're not replacing anybody. We're working together. We do referrals and.
Thank you.
Thank you.
Representative Ranglin-Vassell.
Thank you, sir. Are there any waivers for doctors coming from other countries with the same level of education?
That's a very good question. I am not sure about that. We have one of our naturopathic doctors in Rhode Island. She received a medical doctorate in Haiti. So she's an MD, was working in an ER there, and really just wanted more options, what she could do with patients. So she got her naturopathic doctorate. But I don't know about people who receive their naturopathic doctorate in other countries and then how that's recognized. And of course, in Rhode Island, it wouldn't be, right now, it wouldn't be recognized because no degree is recognized currently. There's nothing distinguishing, which is unfortunately part of the problem.
So may I just, Mr. Chairman?
Yes, please proceed.
Thank you, sir. Then may I suggest that maybe something that you could start considering, because there are people, and natural medicine is practiced so much all over the world, and there are people who have the same level or even more level of education. We want to make sure that they're able to practice the same level while here in this country and in the state. So I would suggest and highly recommend that.
So just to clarify, are you talking about someone who's a naturopathic doctor or someone who is trained in natural medicines?
The doctor. Let me just say that because I don't want to get all tongue-tied.
I think she's talking about a pathway for naturopathic licensing from individuals who are not born in this country.
Yes.
Right. Okay, good.
That's a great idea. I fully support that. Thank you.
Yes, Representative Donovan.
Follow-up question. Thank you, Mr. Chairman. So this is just a follow-up question. So in your opinion, would something like this open the door for more integrative medicine in Rhode Island?
Absolutely. More. Sorry.
Yes, and more physicians partnering with you in their
Yes,
practices.
Absolutely. In the states where naturopathic doctors have been licensed the longest, states like Vermont and Oregon and Washington, there's integrative clinics throughout the states. So you have medical doctors working side by side with naturopathic doctors, and sometimes even at those clinics, other types of practitioners. So you can really everybody's expertise are utilized. Cancer Treatment Centers of America are kind of an example of that, specifically in oncology, where medical doctor, like oncologists, acupuncturists, chiropractors, and naturopathic doctors they actually meet together, talk about patient cases, and then the patient gets treated. Right. So it's very kind of integrated together and holistic, so every kind of aspect for that patient care, and it really works well. And I think Rhode Island would be a great place for that to happen. And economically, we sure could use more options.
And that would also open the door for MD physicians to get certified. There'd be perhaps a certification. Well, they would have to do the same program that you do then, if they wanted to be an integrated MD physician.
Yeah.
Is that what they would do?
So the medical doctors in Rhode Island that are utilizing and have some of the knowledge that we're very specifically trained in, they've gone outside of what their baseline training and sought it out.
Yes.
So that's kind of what happens. And I think over time there may be more options for medical doctors to do that, and we'd be happy to work hand in hand. Our focus, this is kind of our expertise area, but there's definitely room for integration. It's not one or the other.
Okay. No.
Representative Lancia.
Yeah, and I also, as I was preparing for today, it appears that even the National Institutes of Health has provided funding to naturopathic institutions, and that naturopaths have been awarded competitive National Institute of Health fellowships.
Absolutely.
So again, there is, and it's, and as they say, as it becomes more empirically based, nutritional, as you say, the botanical, and the naturopathic treatments.
Absolutely.
So that was interesting to me to find that out too. So that's on a national level. So
Yes, thank you for sharing that. Yeah, we have research going on at most of our medical schools. There's a research institute, and then research funded with the National Institute of Health.
I
Absolutely.
think that's exciting.
Yes,
So
absolutely.
for the members of the committee, we have some MDs and medical professionals that have signed up. So if you have questions specifically about those areas, they may be able to answer them. Marcy, one quick question. Is this similar to the Massachusetts statute, similar to the statutes than other states?
Yes, it's on par. It's on par, and some of our scopes, we are starting with the basics. Some scopes in other states are actually expansive, but this is the absolute things that we have the training and expertise in.
Okay.
It's on par with other states. Yes.
Thank you. Yes, Representative Ranglin-Vassell.
Chairman, are people excited about this?
I am. I hope you are. With the patients we see, the patient calls we get, the people who want to see us, there is a lot of excitement. And I think part of the challenge is just raising awareness about who we are and that we exist. Because I grew up in New England, I didn't even know about naturopathic doctors, and then I discovered it when I was researching medical schools. So I think some of it is awareness raising, but the people who find us out because they want this medicine, or they have a chronic health condition that they're frustrated with their options, they really are passionate about kind of learning skills to help take care of themselves and other options where there aren't side effects and things like that, where they can kind of self-empowerment, which is a really good thing.
I'm excited.
Representative Donovan?
I'll just make a confession. I take a family member on an 8-hour round trip to visit a integrative physician in New Jersey because there's no option here for a chronic illness, when you need options.
Absolutely.
And you need hope. So
absolutely. Yeah. Thank you for sharing that.
Thank you, Dr. Fiban. Thank you very much. Next.